are actually talking about the common myth that we have in our society that excess sleepiness can cause increased cardiovascular mortality as well as morbidity. Now, what is excess sleepiness? As we all know that good amount of sleep is required for a normal person to sustain his normal health and physique. Then what is the excessive sleepiness? In general, if we find a person to have the propensity to go to the sleep mode, particularly at the time of his working hours, then we consider that the sleepiness is much more for that particular person. At the same time, if a person is always having the nighttime sleep deprivation because of his professional assignment, then we cannot ignore the importance of sleep at the daytime. Having a good amount of leisure at night time to go for sleep, and despite the fact if that person is prone to develop sleepiness in the daytime, particularly if he or she is found to have going into sleepiness right away, just sleeping or watching the TV idly, then we consider there is something abnormal with that person, and we always consider this situation as abnormal. Now, what kind of situation can happen or trigger this kind of problem? Now, we often heard about a problem which is called sleep apnea. This is very common in our society and being increasingly diagnosed nowadays in our society just because of the availability of sleep study or polysomnography. The person who doesn't have a good quality of sleep at night time, especially having snoring or fragmented sleep pattern, can easily develop this kind of hypersomnolence or hypersleepiness during the daytime, and this person are very prone to develop some cardiovascular illness in the form of hypertension, increased atherosclerosis, risk of stroke, and last but not the least, lot of arrhythmic symptoms in the form of atrial fibrillation, and on the contrary, some AV block or heart block. If we consider this hypersomnolence or sleepiness into the clinical scenario, this is not very uncommon in our society, and we need to just keep watch on those persons who are developing this kind of symptoms in our day-to-day life. Means whosoever are practicing or treating the symptoms for atrial fibrillation or hypertension, those are considered to definitely have this kind of insight or introspection for ruling out this sleep disorder. So, in nutshell, sleeping disorder can lead to hyper sleepiness or hypersomnolence in the daytime, but we actually cannot ignore the importance of good amount of sleep and sound sleep when the person is actually assigned to take rest. Maybe it is daytime or nighttime. Thank you.